This is My Child Will Thrive, and I'm your host, Tara Hunkin, nutritional therapy practitioner, certified GAPS practitioner, restorative wellness practitioner, and mother. I'm thrilled to share with you the latest information, tips, resources, and tools to help you on the path to recovery for your child with ADHD, autism, sensory processing disorder, or learning disabilities. My own experiences with my daughter, combined with as much training as I can get my hands on, research I can dig into, and conferences I can attend, have helped me to develop systems and tools for parents like you who feel overwhelmed trying to help their children. So sit back as I share another great topic to help you on your journey. A quick disclaimer before we get started. My Child Will Thrive is not a substitute for working with a qualified healthcare practitioner. The information provided on this podcast is not intended to diagnose or treat your child. Please consult your healthcare practitioner before implementing any information or treatments that you have learned about on this podcast. There are many gifted, passionate, and knowledgeable practitioners with hundreds, if not thousands, of hours of study and clinical experience available to help guide you. Part of our goal is to give you the knowledge and tools you'll need to effectively advocate for your child so that you don't blindly implement each new treatment that comes along. No one knows your child better than you. No one knows your child's history like you do or can better judge what is normal or abnormal for your child. The greatest success in recovery comes from the parent being informed and asking the right questions and making the best decisions for their child in coordination with a team of qualified practitioners in different areas of specialty. Today's podcast is sponsored by the Autism, ADHD, and Sensory Processing Disorder Summit. In order to learn more about the summit and to sign up for free, please go to www.mychildwillthrive.com/summit. Hi, everyone. I want to welcome you back to the My Child Will Thrive podcast. I'm Tara Hunkin, and I am really glad to have with me today Sharik Peck. I met Sharik back in 2019 at the IAFNR, so the International Association of Functional Neurology and Rehabilitation Conference in Atlanta, Georgia. He came there because a functional neurologist had found his amazing tool that he has developed in his practice as a physical therapist. He has advanced degrees in physical therapy and rehab counseling, over 28 years of helping people eliminate pain from their lives. And Sharik experienced several disabling accidents, including a broken neck and back, a stroke, a dislocated shoulder, and years of chronic pain, as well as his wife suffered from chronic neck pain. Out of all those experiences and an intense desire to help others in chronic pain, it drove him to figure out a natural solution. His research focused on resonance and its effect on the human nervous system. The tool that he developed is called the Pain Turner Pro, and I think there's number 2 now, the second iteration of it already, and it's the result of over 10 years of research and development. It's been awarded 3 US patents and 1 patent in China. And the reason why I brought him on today is that I was just telling him before we got on here that I think it's one of the best kept secrets, which shouldn't be a secret, in helping do work with our children in terms of helping them with their nervous system and doing neuro rehab. That's how I came to find out about it because the functional neurologists were starting to find out about this amazing tool that a number of them are now working with. And if you follow a number of the functional neurologists doing the work with our children, you're going to see them using the Rezzimax, which is, I'm going to hold it up now because I have one. I've had one since 2019. We use it all the time in our household. So if you're listening in today, remember you can also see the video of this episode on our website or on YouTube. And I recommend you do that if you want to see what the device itself looks like. Anyway, without further ado, Sharik, it's so nice to have you here today.
Tara, it's very nice to be invited here. I love the work that you're doing. Work that helps each individual in their own family must be shared. This is an arena where none of us is a true full expert, and we've all got to share things that we found helpful. One of the things I forgot to put on there, but might be important for this discussion, is I spent about 14 years as a pediatric physical therapist. And this was back before I even understood these tools. I've been working with children in school systems and early intervention. And And I wish that I'd had these tools
Mm.
back when my practice was 100% or primarily focused on children.
Yeah, well, it is one of those tools that in preparation for us talking today, and also over the years, I've watched the videos of a number of, like I referenced, a number of functional neurologists that are using the Rezzimax in their practice now with adults and children alike. But it's really, obviously, I focus on the things seeing in terms of the children, but just the impact that frequency can have, and vibration is what we're talking about. But it's more nuanced than that can have on the nervous system, and the response that it gets is just astounding. One of the reasons why I love it, it's non-invasive. It's something that is not difficult to do with a child. They actually find it, and we can talk about that in terms of one of the most powerful things that I see it do is the down regulation of the nervous system. So getting them out of fight or flight and helping with that vagal tone. There's just so many uses for it. And then on top of that, as we age, which we don't like to talk about so much, all those little aches and pains that come along with going through life, it's helpful to everyone in the family. So it's one of these tools that, yes, you might initially invest in it to help your child, but you'll actually end up finding that you're using it with everybody in the family. So it really is a real treat to have you here and talk about, where did it all start? So talk to us about how you developed and how you came to understand the fact that vibration in different frequencies was going to have this impact on the nervous system.
You know, there was, this was 13, 14 years ago. I was practicing and trying to help people with all kinds of conditions. And I had this problem that I'd had all of my professional career. I wondered why it was that some people seemed to get better and others did not. And it seemed like the same approach would help one and not help another. And especially when it came to my wife, about that time, I have 7 children. So it's a busy home. And as my wife was, trying to take care of 3 kids in diapers and take care of our family, take care of our business, she got to the point where her neck locked up and she could hardly move her head. And here I was, a person treating people for that every day. And I couldn't help my wife. And some of my hardest patients, I couldn't help them. And I could not understand why the normal tools available to me as a physical therapist were not working in so many of these very important cases. And I engaged, I took classes all over the place. I studied from every technique I could figure out to try and help me. And one night, actually, I had this remarkable experience. It's now been almost 14 years. And I woke up in the middle of the night with this message reverberating through my nervous system. I don't get messages during the night very often, but this message, and it wasn't a vision, wasn't anything like that, but I just had this message reverberating through me that said, Sharik, vibration will heal the human nervous system. Now you go figure out how. And I woke up in chills, and I mean, it was just, I was on fire. And I turned to my wife, and you don't wake her up at 2:30 in the morning, but this is what I did. And I'm like, Cheryl, I need an electric toothbrush. And she said, well, you have one. You see, the only thing I could think of at that moment was an electric toothbrush vibrated. And she said, you have one. I said, no, I need one for my patients. And she said, that's gross. And she went back to sleep. and I sat awake the rest of the night trying to understand this message. Then I started, putting it in terms of what I understood of the human nervous system from my years of study and my own experiences. It's not everybody that gets to experience a stroke at age 17 and learn to walk again. But I got to learn how to walk and how to talk and how to communicate and how to write words and feed myself. And, all of these experiences that I'd had in my life were running through my head while I was overlaying that with Vibration. What is vibration? Well, first thing in the morning, I got up and I started an internet search. And I realized very quickly, you don't do an internet search on vibration therapies, because it brought up all kinds of stuff that I didn't really care to know about. Apparently, the world uses vibration for things that I really, it's not part of my therapy world. So I started trying to understand the message in terms of this. Okay, there are vibrational energies out there that really are not that good for us. Speakers at a concert can cause deafness. Well, that's vibration. That's, the energy of music is vibration. And jackhammers, those are vibration devices, but they're not therapeutic. And then I started reading and realized, well, some people develop carpal tunnel from having their hands on equipment that vibrates all the time. And so I just threw myself into this, and I realized there's a big difference between vibrational energy that's just kind of a garbage can term for vibration and true resonance. Resonance is a musical term. Resonance creates power with vibration, whereas vibration can be a very big destructive tool as well. So I focus my energy and my study onto what is resonance and how does that work and how does that affect the body, and oh my goodness, years of studying in that. And I realized that many of the vibration tools out in the market are not designed to really get your nervous system functioning well. They're designed to maybe be an interrupter in your pain signals. And a lot of vibration devices will interrupt your pain signals, but very few of them will actually help you create the loop to get your nervous system connected from head to toe. That's what we set about trying to create, and we've been quite successful with that over the years. So this energy, if you will, is in terms of musical energy, is how the brain recognizes that. And then one day I stumbled across something that I'd probably learned years ago in school. And that is that the best healing system in the body is controlled by the vagus nerve, the 10th cranial nerve. And it just so happens that your vocal cords are a branch of the vagus nerve and they vibrate. I thought, aha, I think I'm finally understanding that message that I woke up with one night. You see, if you can take a perfect level of energy and it vibrates and your vocal cords vibrate, it means that the two of you can create a choir of two. So we created an energy in a range that your vocal cords recognize and can help your brain create a song for healing within your own nervous system. And then we took it a step further because a bunch of my study had been looking at the harmonics of the purring range of a common cat. We think cats have 9 lives. Well, why do we think that? Is because they heal from just about everything. Wasn't that long ago. I remember there was a family that was moving to Alaska from California, and their cat went missing. And they were so distraught, but they didn't know what to do. Well, they finally get up to where the container with all of their stuff had arrived in Alaska a month after they had moved, after all this stuff had moved. They open up the door of the container and out comes their cat. Had nothing to eat, nothing to drink for a month. And that thing was still alive somehow. We hear all kinds of stories about, a person in a family is sick and a cat will come up and purr and purr and purr. Well, they use that mechanism to heal themselves, but they can also use that mechanism to heal others. And the research on it was really fun. You see, the purring range of a cat will speed up bone healing in a fracture by over 66%.
That's amazing.
Well, if you follow the logic on that, how does that happen? It's not by magic. Those cats have terrible attitudes. They do not do anything to try and really, change the world through magic. They but the harmonic range of a cat's purr, it helps stem cells to be activated in the body. That's what speeds up bone healing. And so I started taking all of these concepts together, and I said, okay, I cannot find an energy source that does all of that. 8 years ago, we started in the process of making our own. So we spent about 4 years making a device out of China. That was difficult. There were a lot of struggles with trying to make things over there. 5 years ago, we came over to the US and said, okay, I realize it's going to cost us 5 times as much to make a device here, but it's the right thing to do. And now we employ hundreds of our neighbors in helping create and make these tools that we're now sending out to people in 60 some odd countries. It's just been a remarkable process, Tara.
Yeah, no, that's an amazing story. It's fascinating how it's evolved over time, and your research and exploration just from that middle of the night realization, or however you want to explain what came to you at that point in time. And so I'm grateful for that as well. Let's just before we get into, we're going to get into some of the more specifics around how people are using this with their children and what that's doing for them, so people can learn about that. But let's just talk about the device itself for a few minutes. I'm holding mine up, so for people that are listening, I'm holding it up right now. It's an interesting looking device that is not it's not like anything anyone will have seen out there before. So it's a longer device. It has wings on it that I know you use for scraping, and that they remind me a lot of some of the tools that you will see in either physio or in chiropractic clinics, because using scraping on the muscles as part of some kind of soft tissue work. And then there's also a pair of, I don't know, what do you call these typically?
Well, if it's a tuner, those are the tuning forks.
The tuning forks, that's right. I guess that's right. I call them like the prongs.
Yeah.
So really what it is it allows people to connect it to the body and in different ways. And the best way to do this is to look at it, all the different videos you guys have online to really get an understanding of it. But how would you describe, well, let's talk about like how you would use this for vagal nerve stimulation, like how that's used, because that gets back to the idea of purring and humming and all the rest, right?
So can I take you one step back and tell you a little bit more about why those parts and pieces are there on the device?
Oh, please, yes, do.
You know, Dr. Michael Trayford sent me a note one time, and he said, you know, I've realized that everything on that device has a purpose. And I said, yeah, I realized I did not create it for mass marketing, because you should be able to look at it and say, I know exactly what that's for.
Exactly.
But every part on there has a purpose. So those 2 tongs are actually to help you connect right and left hemispheres in wherever you place it, so that you can get the right and left hemispheres of the brain, right and left sides of the body, communicating better. Yeah. You've got a right vagus nerve and you've got a left vagus nerve. And so if we can get attachments close to the right and left sides of the body at the same time, we bring a better sense of balance. Those wings on the device, you're right, they were created to help those who perform what we call instrument-assisted soft tissue mobilization. That's a whole lot of stuff. They call it in therapy IASTM. And in China, they've called it gua sha for like thousands of years. But it's essentially just using a blunted object to stimulate an area of chronicity or chronic pain, so that the brain says, whoa, I'm being attacked. And instead of it thinking of it as a chronic condition, the brain now treats it as an acute condition. Well, it can heal an acute injury. It has a real hard time healing a chronic injury, because all the pain signals have jammed the circuitry and the brain doesn't know how to help it heal anymore. So we change it to an acute state. That starts the healing process over. And what we found through our research was that when you took the age-old IASTM or gua sha and hooked vibration to it, You got no more of the bruising, and you got instantaneous connection with the brain. So we're talking hemispheres. We are waking those things up immediately. And it has the side benefit of helping with peripheral neuropathy, people who have had strokes, people who have a hard time just organizing their body with ADHD or with autism spectrum disorder. It helps their brain reorganize itself by using vibration and scraping at the same time. So it's just taking dry brushing to a whole new level that is remarkable for a child or an adult. So I just wanted to make sure that people understood why there's so many weird projections off of there. The size of it has a 12-hour battery life. So before you need to charge it up, it's going to run for a lot of hours. I wanted that because, you know, when you're working with somebody, it's awful if you have to say, well, let's go plug this in for 30 minutes, then we'll start your treatment over again. I wanted it to run and run.
I was just going to I'm just grabbing another, I know you have your own version of this, but when I got when I got mine, you weren't using these. This is just one I got from a different place, but just the little squishy ball, which you can also put on top and use that if you need a softer tip on it. So you guys have your own.
We just take, and you can take any Nerf ball or brain, squishy brain, you poke a hole into it with the device, kind of screw a hole into it there, and it makes a super soft attachment for just any sensitive areas.
Yeah, which I think is especially helpful with the kids that, you know, as they're starting to get used to that vibration and using it, it's a much gentler way to get them going when you're first doing it. So I just wanted to point that out as well.
And I love the color that you've got on yours, because kids love colors.
Yeah.
It helps.
Yeah.
Keep it fun.
Exactly. So we'll talk more about the device, and because there's a bunch of different settings on here too, so you can, because as you and I both know, that everybody's individual and unique, and it depends on what you're doing and why you're doing it, in terms of what resonance that will work best for what you're working on at the time. But let's talk a little bit go about that, what you can do with this particular device for vagal tone, because this is one of the tricky ones with kids, because the typical things that have been, that are known to work to help you work on stimulating your vagal tone, humming being one of them, but gargling, and then, the dreaded gag reflex, which we're never going to do with a child. There just aren't a ton of things that are easy to do with a child in particular. We do know that all of these kids, no matter what they're struggling with, really, in terms of neurodevelopment, whether it's a child with autism or ADHD and any of the other things that's going on with them, whether it's dyspraxia, dyslexia, all of them can use, and anxiety in particular, vagal tone. So what can we do with the Rezzimax, and why, again, let's just go over why it works to help.
Well, one of the first things that you need to know, because those vocal cords vibrate, you can place this device anywhere on the body, and the vagus nerve is getting a cueing from it. You could put it at the feet, at the legs, and the vagus nerve is measuring that in terms of vibrational energy because of the vibrational energy of your vocal cords. It tunes into it automatically. But there are some things that you can do to speed up the process. And if you look at where the vagus nerve goes, because it starts in the brainstem, goes the pineal gland, pituitary gland, we don't have great access to some of these, but we do have great access to the edge of the ear. And so there are points on the ear that you can use the device to get great access. You can, for example, just take that little soft attachment and just place it at the ear. Or if you want to get right into a particular point, use our little clear attachment, stick an earplug, like a shooting earplug, stick an earplug into there so it's a super soft tip, and you can go to all of the acupuncture points on the ear. If you don't know where those are, just look it up online. You can find anything on the internet these days. So, so it's easy to find some of those points, but where else? The thyroid gland. So anywhere that you use it around the neck here is a tremendous way to get access into the vagus nerve. It has two very strong branches that come down just underneath the angle of the jaw there. So you can have great access to that area. And then as you're humming to that, and here's something that not a lot of parents understand, but I want to make sure that they do. Your child may not be verbal, but you as a parent have a direct connection with that child. So if you place it there and they're not humming, but you as a parent are humming, you are enhancing the benefit of the therapeutic effect of these therapies for your child. We have moms and dads hum while this device is in place for even, the smallest of children and babies. So you get great access to the thyroid, the thymus gland, right underneath the breastbone here. The heart has a connection from the vagus nerve. The diaphragm has a connection from the vagus nerve. So it's not too hard to place the device in such a way that we have connection with diaphragm. We also have a connection with the thymus and the breastbone and the heart and everything there. So we have greatly enhanced the communication effectiveness of the vagus nerve with the brain when we place this anywhere on a child, but especially around the head, neck, shoulders, and thoracic area. And of course, that vagus nerve goes to the bowels, it goes to the, all of those important organs. The adrenal glands, it does not go to the adrenal glands, but it goes to every other very important organ, including the liver, the thymus, everything down there, even clear to the midsections. So you can place this device right on the stomach, right on the belly button, and have great access straight into the vagus nerve loops that take information to the brain. So one of the issues, Tara, that many of our parents see is bowel and bladder issues. Well, if they can take a device like ours and put it on the tummy, it helps train those systems to be able to function better. And oftentimes, if you've got sluggish bowels, you'll just want to take this and trace the whole bowel loop with it. Trace out that large intestine and turn this on and just get that resonating. You can place it right over the bladder for a child that's having a difficult time connecting their bladder with the world of potty training. I've been watching a mother over in New Zealand do this with her 7-year-old child. She's been potty training finally, and helping her to become more aware of that whole area. The tuner has played a great role in helping her to become connected and aware of her parts and where everything is at and how it works. So it's just a great communication enhancement.
That's amazing. It's really interesting to see how it helps that connection of the mind or the brain, the body, which a lot of our kids are struggling with. How do you see in the people that have been using it that it's helping with emotional regulation? I think there's some great testimonials and interviews you've done with parents on that particular issue. So, which is such a difficult one, especially in the moment of a meltdown or an overreaction of an older child. What have parents seen, and why is it that being able to use the Rezzimax in those moments makes such a big difference?
First of all, going back to the anatomy, we know that when a child or an adult, any of us, when we start into the fight or flight process, our amygdala takes over in the brain, and then our frontal lobes shut off. Well, that means the thinking parts of our brain are not working. So you cannot reason with a child that's in a meltdown. The part of their brain that would make sense of your words is not working. So one of the neatest things about our tool is you can place it anywhere on the body, and it helps bring the frontal lobes of the brain back online. So many, many parents have found this little secret and say it's saved their lives. because their child starts into a meltdown or starts into, you can see that upregulation happening because you can feel it too. A child starts upregulating and suddenly your breathing shortens and you're responding to all of that. Well, if you just take the device and place it on them, it encourages them to start breathing, and it encourages them to start having other sensations rather than just the upregulation that was happening. It activates that vagus nerve during the stress response, which is a big part of the definition of resiliency. It's taking something that fires us up and saying there's something else that's more important. It gives the brain something to focus on that keeps us from going all the way to a meltdown. And countless parents have told me this has absolutely been a game changer, a life changer. Another good example of that emotional regulation came from a mom that told me, her 14-year-old daughter was not verbal, and she had just struggled trying to figure out how to communicate, and the child was melting down all the time. Well, within a week of using our device and starting some of the stimulation, the scraping process from the feet and the fingers, and that within a week, this child started using her first words at age 14. And her mother could attribute it to nothing else that she knew. And she was using words appropriately, like mom, when she needed her mom. That's been one of the funnest things that I never expected to see happen.
It's got to be very rewarding for you, but for parents out there that are listening to this, I mean, it's obviously it's life-changing. Every little gain that you get is a big improvement. Like, sometimes one word is not a big deal for parents of children that develop typically, but for someone to have their child for the first time say mom at 14 is pretty spectacular and exciting to have. And that is why it's interesting. I don't know, I didn't bring up this before, but there's a book that just has come out by the author Gabor Mate, who Dr. Mate has been writing about the nervous system and our responses, but also the blocks and the ability to heal when we are in that if we have attachment issues, basically it's nervous system dysregulation because of certain things that have happened in our lives or trauma or other things. Having challenges through neurodevelopment is a trauma in and of itself that may have resulted from other traumas. So to have that ability to regulate the nervous system is essential to have our kids make progress. That's why the vagus nerves and vagal tone is just so fundamental to healing. And I think that most practitioners out there that have been doing this work for a long time realize that sometimes you're doing all the right things, but you just can't, you still get stuck. I've talked about this before with other functional neurologists, in particular with Dr. Melillo, and the work that he does was that until we started to do that work that could get the nervous system better regulated, things like digestive function would never work on its own. It had to be supported through supplementation and other things. But once you do that work on the nervous system, those things actually can start to work and heal on their own. So that's why it's so profound what this tool does for so many people. Obviously, that's such a big thing. What are the things that if someone was just to be getting started with using the Rezzimax with their child, I know that every child's different, but are there certain things that you say to start with when you very first get access to the tuner itself?
Yeah, absolutely. The very first thing that I tell every family now, as we've learned how important this is turn the device as high as the child seems to be able to tolerate it, and start at the tips of the fingers and work to try and connect every little square inch of skin tissue with this device so that you're sending stimulus to the brain. Mm. If they are weak on one side and you're familiar with that, do it 2/3 of the time on that side and 1/3 of the time on the stronger side. But the whole body needs this input. And wake up the pathways from the tips of the toes all the way up. So this scraping process, this brushing, if you will, with the device on, is sending billions of bits of information up through the joint receptors, the mechanoreceptors, the muscles, the nerve endings, the ligaments. All of these parts and pieces are taking messages to the brain that help the brain start to organize itself. It helps a child to start to understand where they are in space, a concept we call proprioception. And if the child cannot feel where all the parts and pieces are, or they have jams in their signals so that the communication is not correct, they will not develop their musculoskeletal system and their brain in an appropriate manner. So that's the first thing that we'll start with, is getting those connections from tip to stern all the way so that the brain can make sense and organize the body. That's a process that we'd love to see 15 to 20 minutes a day spent on your average child. After they've done that process for about 6 weeks, you don't need to do it nearly so often, but you can grab it, once or twice a week, and for 4 or 5 minutes, get the brain to remember all of those connections. With those who have done that, they see the nervous system start to organize better. They see a decrease in the behavioral challenges that they've experienced, and they see the children starting to engage more and calm. So that would be my first. My second would be just to take the device, and we make a fanny pack for it, put the device in the fanny pack, turn it on. It has a mesh side of the fanny pack so you can access the buttons. Turn it on to absolutely any level and just strap it to the child's tummy or their back while they're doing activity. And if you understand the hemisphericity of your child, so you're driving more information towards the left hemisphere, you'll orient it more towards the right side of the body. But if you're just going for overall improvements in tone, whether that's decreasing tone or increasing tone, it still functions to help the child normalize tone. So its job is not to increase it or decrease it. This job is to normalize it. And so just placing that on there while they're doing any other activity, and it could just be laying down, it helps their brain to make sense of their environment and their surroundings and start to function better. So then you can get into all kinds of specific treatments to drive information to one spot in the brain or another. But those two very important things, the scraping and the strapping it on, are extremely important. And if you know which side's weak, strap it onto that leg. There's a little extremity strap for it. And we've tried to think of everything to make this easier for a parent. And hopefully it does. If there's something that you have questions on, I take calls and do Zoom calls all the time to try and help parents understand how to apply these therapies a little bit better for their particular situation.
That's amazing that you still have a time to do that. So that's incredibly helpful. So when you're talking about, so let's I'm going to clarify a couple things. So a lot of us, if you listen to other episodes of the podcast and the other things that we do talk about balancing the brain and the hemisphericity, and Dr. Robert Malilla's work in terms of disconnecting kids and his the brain balance centers. So if you know which side of the brain that your child has a weakness in, you typically would put the device on the opposite side of the body to that weakness. Is that correct?
That's correct. Yep.
So, and then if sometimes our children have a dominant side of the brain as opposed to they have a dominant side. So then again, we're going to put it on the dominant side. So then it works the less, so it can downregulate, like actually bring the other side up to that dominant side. There are so many things that we can do. Obviously, I want everybody to know that if you are interested in getting yourself a Rezzimax Turner Pro 2 for your own home, Sharik has a generous offer to the My Child Will Thrive community of a 20% discount, and you can get access to that discount through either the code Thrive20, or we have a link in the show notes to get you directly to the product that we're talking about. Sharik, before we go wrap up today, I do want to talk about, you have new things coming up too. You're constantly innovating and coming up with new things to improve the experience as well, and new devices. Can you tell us a bit about what's coming up next for you guys at Rezzimax?
You bet. One of the things I'm super excited about, super excited. This is the problem when you can't shut your brain down very good and you want to invent all kinds of things. You don't get to sleep very much at night. So when I get my 5 hours in, then my brain wakes up and says, how can I help the world? Well, one thing in particular we've been working towards for a long time, and it should be out hopefully within the next 3 or 4 months, is a miniature version of our tuner. It'll run the same patterns, the same algorithms, just a little different instrument, half the size or so, that lets it sit in a pocket really good, or be very unobtrusive for sticking it in a backpack, or sending it with a child to school. The other tool that we're looking at bringing out in the next 4 to 6 months here, maybe sooner, is a app-driven version of our device. So you can now fine-tune it, if you will. I mean, the device has 20 setting levels and 8 different patterns now in our new Tuner Pro 2 device. This could potentially give a provider or a family that wants to fine-tune the frequencies for their child. It gives them potentially thousands of levels that they could engage our device in to be able to drive specifically what that child or adult may need to be able to help them move ahead. Oh, there is one other thing. We're launching a pet division. I hope you guys can find us on social media. The Rezzi Pet division is going to teach a lot of the techniques for use on horses and dogs and cats and other pets, and how to use these resonant therapies to help your pets heal and do better as well. So we have a lot on the forefront, and hopefully one day we get to bring all of those and many more things out to help the world, just as we've been helped through so many things.
That's amazing. I am very excited about all of those things. I mean, the little one that you will be able to actually send to school, and you'd mentioned to me too, you're even trying to make it quieter, that the kids can take it and it's not going to bother anybody else by having that there. But also, kids don't want to look any different, but when they realize how well these tools work for them, it's so nice that they'd be able to take something like that with them and use it very discreetly at school. I think that's incredible. And obviously, the more we can personalize the experience, it's always better to the app device. But then, of course, before Sharik could see it, if you're watching this on video, I actually have we are a horse family, and we have lots of dogs and now cats. And so I'm very excited to hear about the pet division. And I'm sure many families at home who have all those lovely fur babies that they like to look after as well will be super interested to see what comes out of that as well. So we'll make sure that link to your social media for the new division is also there. But again, I want everybody to remember that if you are interested in the product, you can go to rezzimax.com and use the code Thrive20. That will give you a 20% discount off the product. So thank you very much for that generous offer. I'm also going to link to obviously all the social accounts on this in the show notes, but also there's a great YouTube channel that you have wonderful presentations from, you mentioned Dr. Michael Trayford, who does a lot of work with your devices in his clinic, and he's lectured about that in the past, and some other parent testimonials, and we'll make sure they get linked in the show notes as well, so you can go straight from our website to those videos, because it does make a big difference when you see families like yourself and practitioners that are talking about it, to really start to understand the power of something as what I'm going to say is simple. It's not simple, but you've made it simple as resonance and vibration and frequency in helping wake up that nervous system and get us moving forward. So thank you again, Sharik, for all you've done in terms of waking up in the middle of the night and creating these products and continue to push to drive it forward. It is not an easy task to invent something new and get it manufactured and get it out to people and make those differences. So thank you for all your work and your family for supporting you through that. And I look forward to talking to you again as these new products come out.
Thank you. Thank you, Tara.
That's it for today. We'll be talking to you again very soon. Thanks for coming. So that's a wrap. Thanks for joining me this week on My Child Will Thrive. I'm so passionate about giving you the tools and information you need to help your child recover. And as they say, it takes a village, so join us in the My Child Will Thrive Village Facebook group, where you can meet like-minded parents and stay up to date on everything we have going on at My Child Will Thrive. This is Tara Hunkin, and I'll catch you on the next podcast or over at mychildwillthrive.com.